Hi everyone, we're here today with Lisa Fenster, who is an amazing speech language pathologist. And of course, I'm Dr. Ellie, and I'm here with my podcast, I Heal Kids. And I'm founder of the practice Middle Path Integrative Pediatrics in Asheville, North Carolina. So if you need a holistic pediatrician and you live in or around Asheville, definitely reach out to me. And if you need a speech language pathologist in or around Asheville, then definitely reach out to Lisa. And Lisa, thank you so much for coming today. It's so great to have you. I was hoping you could just tell us a little bit about yourself.
Yeah, so I'm a pediatric speech language pathologist. I've been doing this for about 10 years. I work with kids from ages 3 to 21, really, and I work on language, so how kids put together sentences and conversations. And then I work on speech, and that's kind of my specialty right now. And that's how kids put together sounds to make words.
There's like a distinction. I've thought about that before, but I think that's something like parents have a lot of questions about, like, what is the difference between speech and language? And so you're saying the speech is the sounds and the language is how they put together the words.
Right. So I say it's how you say what you want to say when you want to say it, and how you understand what other people are saying to you when they're saying it.
Okay. Yeah, that's a big difference. What inspired you to even get into a career in speech therapy and speech pathology? What motivated you to even go into this field?
It's kind of a funny story. I was teaching English in Japan, and the parts of teaching English in Japan, like working on language, working on speech, really are what I get to do now. So I get to do the fun part of teaching. And then I also had an experience where I didn't have access to language because I don't speak Japanese. I can't read or write Japanese. So being in an environment where I know I'm an intelligent person, but I can't communicate was challenging, and it's something I want to help people who are in that situation.
Well, that's amazing. So you actually were in Japan teaching English, but you could not speak Japanese.
Right,
That is so
right.
wild to me. Yeah.
Right. So
I
it took a
mean,
few years to learn Japanese, and I speak it now, but at the time I was learning please and thank you on the airplane over there.
oh, that is amazing. So you must have had that experience of like, I can't speak, but I want to. And that I would imagine that would like make you relate a lot to your patients
Yeah.
or like think
Yeah,
about that.
it does. It's a really amazing way to be in their brains and be in their bodies, is to be not having access to language.
I actually have a similar experience. When I did my residency training, which is the training where you become a pediatrician, I did that in Miami, and the predominant language in Miami is Spanish. And I was like, oh my gosh, you guys. And I remember there was one hospital that I worked in, and there were a lot of people who also spoke French. And so I've taken a little bit of high school French, and then I had picked up a few words of Spanish. And it was a hot mess. It was like 2 a.m. I'm trying to pick out the French word. I'm trying to pick out the English word. I'm trying to pick out a Spanish word. And I was just like so lost. And so, yeah, I think for lack of a better word, speaks to like how important being able to communicate really is.
And, everyone deserves a voice is a big thing you'll hear speech pathologists say. So we really want to give everybody an opportunity to communicate in whatever way they can.
Yeah, 100%. So I think a lot of people are like, well, how do I even know if my kid or maybe myself, like, how do we even know if they need speech therapy? Is
Right.
it like an issue if they have like a lisp in there too? Or, like what are the things that you kind of think of like as red flags or stuff that you would want to see in your
So
office?
if a friend or family member comes to visit your family and they haven't met your child very much and they can't understand 75% of what your 3-year-old says, it's probably a good idea to get checked out by a speech pathologist. That rate increases to 100% by the time they're 5.
So if like your mom comes over and
Mm-hmm.
your 3-year-old is speaking and she's like, I don't know what they're saying,
Right.
that could be a sign, like tell your pediatrician to give you a referral to a
Yes.
speech language. Okay.
Yes.
What about like other things like lisps or like stutters and things like that? Are there certain like ages or times where they're more of a concern than others?
So stuttering, they usually grow out of it by the time they're 4 or 5. And if they haven't, you probably want to see a speech pathologist. For a lisp, That's usually something that we see go away by the time they're 5. Same with their L sounds and their R sounds. They should have their R sounds by the time they're 5. So I have a lot of
Okay.
kids that can't make the R sound and they make a W instead. And those
Oh,
kids need to
wow.
see a speech pathologist.
Is it just because of like the anatomy in their mouth that they're having these issues with making the different sounds, or like their aura motor, like their ability to kind of move their muscles in a certain way?
It can be, or some of the kids can't hear the difference between the R's and the W's. So it's practicing that with them and teaching them the rules.
Okay.
So, sorry, my dogs are barking in the background.
that's, that's just the hazard of the pod. We'll go in and mute that as much as possible. It's fine. And what about stuttering? Like, is that some people think like it's because their mind is racing really fast and things like that. Does that have anything to do with it, or is it something different?
It's really just the mind moves faster than the articulators, the parts of the mouth can keep up. It's hereditary. We see it a lot more in families where there's someone who else in this family who stutters. We see it a lot more in boys than we see it in girls. We're just kind of watching out. There's a whole plethora of things that can contribute to it, but we're trying to help
Yeah, because I
whoever
saw
has
that movie. What was it? Like the King's, was it the King's
the
Speech or
King's
something?
speech. Yeah.
Yeah. And I was like, I wonder if these are some of like the exercises that like happen in speech therapy, or if there's like new advances. So like what even really happens during speech therapy? Like what should people be prepared for or thinking about when they go?
So it's a lot. I do a lot of play-based therapy. I also do a lot of structured therapy. So your kid might come in and be playing with a bowling ball and some bowling pins and bowling, but they're practicing words with me as they're doing that. Or we might just be reading stories and talking about the stories and making our own stories. We could be playing hopscotch and practicing words. It just depends on everybody's mood and how the weather is and
Yeah.
what we're working on.
Yeah, I imagine, because right now, as we're recording, we're having a giant snowstorm in Asheville, and I can't even imagine being outside playing hopscotch in this. So I'm sure
Right.
like all those indoor activities.
Right.
So that's really neat. So I didn't really realize like while you're playing like what seems like a game, you're actually doing the therapy. So like if you didn't know that as a parent, you might go and think, well, all they did was like play the whole time. But really like what you're doing is introducing the words and the speech and the sounds like while you're doing something enjoyable with the kiddo.
Right. The kids learn best through play. So we're trying to incorporate that as much as we can into the sessions and into our time. And if a parent ever feels like, hey, all you did is play with my kid, I really encourage you to speak to your speech pathologist because there's a lot of techniques and methods that we're using during the play that you might not see or know about.
Yeah, I think that that's true of like a lot of different therapies, because I do a manual therapy called osteopathic medicine, which is where we kind
Mm-hmm.
of use our little fingers on babies to adjust their spine and their muscles and everything. And it can really look to parents like all she did was stand there and put her fingers on my baby
Right.
and like didn't do anything. But yeah, just really asking like a lot of questions and exploring like, oh, what exactly are you doing? I think that's a really like
Yeah.
helpful thing, just to feel empowered. And also like seeing a therapist, you feel comfortable to even ask those questions.
Right. Right.
Because yeah, because if you're super approachable, but like if you saw someone that you were like, oh, I don't know if I can even ask what they're doing, that maybe time to look for someone that's just like a better
Mm-hmm.
personality fit or what may,
Right. Right. And there's lots of speech
yeah.
therapists in town who can help. So find one that fits your needs is definitely something I'd recommend.
What do you think, like in your experience, like what are the biggest misconceptions that people have?
One of the biggest misconceptions that people have about speech therapy is that we only work on speech sounds. And that's just not true. We're working on words, we're working on language, we're working on all aspects of communication. So we really want to see kids that you can't understand what they're saying, but it's not because you can't understand the words. If you can't understand their sentences, they're kids that
Okay.
probably need some help.
So would that be like kiddos that are like switching their words up or like
Yeah,
changing parts of the words out?
right.
Okay.
Or using grammar that just makes it completely understandable.
Okay. Yeah, I could see where reading, especially, I mean, correct me
Right.
if I'm wrong, but I feel like reading especially would be so helpful for that, just to like see and make the sounds of the sentence structures like over and over
Mm-hmm.
and hearing it.
Right.
Do all kiddos that get speech and language, should they all get hearing tests before they come?
100%.
Okay.
100%. We definitely want to know how their hearing is before the speech therapy starts, because if we can help amplify hearing or help do whatever we need to do in terms of hearing before we start therapy, it just makes the therapy so much more effective.
Yeah, because that is definitely my job. Well, I do this screening test, but then, of
Right.
course, if there's any issues, then I would refer to like an audiologist who would
Exactly.
do a more formal
Right.
diagnostic. So that's important to know because, yeah, if you can't hear well, then maybe that's why you can't like speak well. And then,
Right.
like medically, like maybe if there's like ear infections that are like chronic or like fluid in the ears, then maybe you can't hear well either. So, yeah, there's a lot to look at, I think, with that.
Right.
Okay, so I'm noticing there's like so many challenges that can happen. So there's like language issues, and then there's sound issues, and then there's like specific issues like the stuttering and all of that. Like, how do you possibly even like tailor your approach so that it meets all this range of clients that you see? Because that's I can't even imagine doing that work. Like, it's just so like your expertise is amazing.
The way to handle that is really to specialize. So, like a lot of pediatric speech therapists will help work on feeding therapy and help kids learn to swallow better and learn to eat better foods. And I don't touch that because that's just not my area of expertise. I'm much more a generalist in the language and the speech sounds area. I also work with a lot of kids with autism and teach them how to talk on like iPads or other devices.
I definitely want to talk about technology too.
Yeah, it's really cool. I think just a lot of experience has led me to have the expertise in the areas that I need, and then knowing what I don't know and knowing to refer out for those.
Yeah, I think like so many of us, we all kind of have our niche. Like mine is holistic integrative functional care.
Right.
And, like if you're looking for a pediatrician that's very like surgically oriented or, doesn't like a lot of intervention, then maybe you would want someone else. It's just kind of like what
Right.
you're looking for. Yeah, I think like with your approach though, with doing like the play therapy, I think that creates like such a comfortable environment for kids. I've noticed even with us, like we've been able to collaborate a lot on
Yeah.
the kiddo that I sent over to you and other kids that I'll be sending in the future. And it just seems like super important. Like, how do you collaborate with like other professionals like to create a holistic plan?
So I used to work in the schools, and the reason that I've left the schools is I do want to work more collaboratively with the families and the parents that I'm working with, and the doctors and everybody else who's around the kid and the kid's environment. The biggest thing that I think I do differently than a lot of speech pathologists say in the schools is I ask that parents come in and be part of the session with us. So if we're playing a game, I want the parents to be playing with us. And that just lets the parent know what I'm doing and gives them tools for practicing at home, which makes the therapy so much more effective. Just being open to collaboration is the biggest thing. Just making time in my day to collaborate with you or whoever I need to collaborate with.
Yeah, I think that's like something that's really good about you in particular is like sometimes like in my other life before I moved to Asheville and had this practice, I would send people to like a therapist or whether it's speech or other, and then it would be crickets and I wouldn't get any information back at all,
Mm-hmm.
which people are busy and it's like completely understandable. But then I'm like calling like,
Right,
oh, did
right,
they go or how was
right.
that? But like anytime, like with you will communicate and say like, oh, we're doing this and that. And so then we're like all on the same page and we're a
Mm-hmm.
team, like family, pediatrician, speech language pathologist, like all
Right,
the people that we would need,
right,
audiologist or whoever else. And then, in that way we're creating like a blanket of like whole child care.
right. And I think making the time for that is really important because it's hard to make the time for that.
Mm-hmm.
It's a challenge.
It is.
It's a challenge for
Yes.
sure.
It's such a challenge. And yet, the more we can do it, the better. Okay, I want to talk just briefly about, if it's okay with you, speech and confidence, because it is such a key thing. Like, even podcasting, like I get nervous before I podcast, and my speech, I haven't had difficulties with speech, but I can imagine like if you're having trouble speaking, how that must affect your self-esteem and your confidence and your communication with making friends and like social life. How do you kind of work with clients to kind of build self-esteem alongside the communication skills?
I think it's just making progress that really helps build the confidence. One thing we do with kids who stutter in particular is we try to have them give a presentation to their classmates about what stuttering is. So we're empowering them to know about their stutter and be able to teach about it, but also educating their peers about what's going on and why a kid stutters. So I think that type of approach just really helps everybody out with the confidence, just educating
Yeah.
others, educating yourself, and making progress, having goals and knowing what they are and working towards them.
Oh, yeah. I totally agree with that because my husband's a sixth grade teacher. He teaches English language arts,
Yeah.
and he's had kids come in and do presentations on, if they're not, if they're a child that's not neurotypical, if they're neurodivergent, like maybe they're on the autism spectrum or something. And, he's really noticed in the classroom that their peers are like, oh, now I understand. Okay, I get it. And they're
Right.
more able to interact and like have a healthy relationship. So, yeah, I totally agree with that. I think that's a really good tip. Although I imagine it takes a little bit of encouragement to get the
It
kiddos
does.
to do
It
that.
does. It definitely does. But
Yeah.
once you've empowered the kids to take control, we see that the stuttering goes down.
Well, you had touched on this earlier, and I definitely wanted to kind of circle back to it, but technology, because I see so much technology now that's so amazing. I have kiddos that have, certain chronic conditions where they use their iPad to communicate and things like
Mm-hmm.
that. What have you kind of noticed, like with advancements in technology or research, or what are you most excited about with technology and speech today?
I'm really just excited that we're giving kids access to high tech speech communication devices. Before, we were using laminated cards called PEX cards that we would have kids exchange to ask for a pretzel or whatever. And now we're teaching them to use a much more robust system with the iPads or with the devices to speak. So I'm just excited to see the technology get into the hands of kids more than they were 10 years ago. I'm excited to see what happens with AI and how that can help kids communicate.
That must be pretty amazing because I never really thought about that. But I mean, I've seen like some kids that can like blow air and that can activate like certain
Mm-hmm.
technological systems, which I'm not
Mm-hmm.
a tech person,
Right.
so I'm totally not describing that right. But that, like, even if I imagine like if you have a thought and it can just translate the thought with I mean, how cool would that be?
Yeah, I'm excited to see what happens with that. Right now, we've got really
Yeah.
cool like eye gaze systems out that kids can look different directions and it will create language for them. And
Oh,
it's
that's
really fun to
super
see.
cool.
Yeah.
So do they just kind of look in a different direction and then
Right.
they look at the words they want to say?
Yeah.
Okay.
They can
Okay.
create sentences and, make requests and make comments based on where their eyes go in the conversation.
Can they pick their own voice? Like like are
Oh,
there voices like
absolutely.
that are
Absolutely. The programs all come pre-programmed with 6 or 7 different voices for kids to choose from. So they can use a child's voice that's the same gender as them.
you're not sounding like a grown man if you're like a 5-year-old girl
Exactly.
or
Right,
something.
right.
You can sound however you want. Okay, so this is a question I get about any kind of therapy, including like my osteopathic medicine. Yeah, it's like, oh, it's really, really slow. Same with functional medicine, it's really slow. And it is. But how do you kind of help people stay patient and positive? Because sometimes it can feel like edgy waiting for things to kind of progress. Or
That's
maybe, I don't know if
yeah.
you've ever had this experience, but sometimes, like with my niece and nephew, I don't notice things as much because I see them all the time. But then, like,
Mm-hmm.
if I see a kid in my office a month later, I notice a huge change. So
Mm-hmm.
I don't know. How do you support parents in that?
It's really looking for the progress and really documenting progress makes a big difference. Being able to go back and show, hey, he wasn't doing this 6 months ago, but now he can make these sounds makes a huge difference, I think, with that. Just documenting the progress and showing the parents, hey, this is improved.
Okay. So, like, kind
Yeah,
of going back to your notes and saying,
right.
okay, like when we first started, we weren't
Mm-hmm.
saying S at all. We were only saying W, but now we're saying R like 25% of the time or something like that. Okay.
It's definitely a challenge because you want what's best for your kid. So you want it to happen as quickly as possible.
Sometimes we want that like immediate, like we went for that one appointment, but it
Right,
doesn't always work that way with therapy in
right,
particular, any kind of
right,
therapy.
right.
Yeah.
I do try to provide homework for
Okay.
families so that they can practice skills at home too, which really helps with the progress as well.
So then like parents and caregivers can see like, oh, now they're getting this part of the homework a little bit
Right.
better or with more coordination or something. Okay. Well, if you can share, I would love to hear like Do you have like a really rewarding success story or a story that sticks with you to this day?
Yeah, I had a little girl a couple of years ago who came to me with a speech device that she didn't really know how to use. And I worked with her for about 6 months. And about the 6 month mark, I discovered that she knew how to read and she could read books with her device once she'd been shown the device enough and knew how to navigate it. So nobody in her world knew that she could read. And she was reading books to us after just a little bit of exposure to the device. So it was pretty amazing.
Yeah, that's unreal. So people were thinking like she doesn't even know how to read. And then really it was like she didn't really know how to use her device.
Right,
And
right.
had she never seen you, maybe people would just keep assuming that she didn't know how to read.
Yeah, yeah. So she was able to get more challenging work in school, and it was just really an amazing story.
I'm so glad she was able to see you. I mean, I can't even imagine what would have happened.
That
Yeah.
was really rewarding. Another little guy I had wasn't talking at school at all. And after a summer of working together, he finally started talking at school and making requests and stopped eloping because he could ask to go outside. Those stories are really rewarding.
Yeah. So he actually, this was a kid that would actually like run out the classroom because he didn't know how to ask. Could he leave? Which is so terrifying for teachers and parents because you're like, well, where's my kid? But seeing you, he was able to actually just communicate his needs so that he could go out when he needed to and then come back safely, which is, that's so important.
Just it's just empowering for everybody.
Yeah. Yeah. So empowering. We're almost out of time, but if you had one piece of advice for our last question today, to anyone struggling with speech, communication, anything around speech or communication, or even their loved ones, like what would it be? What would your advice be?
It really would be just remembering that everyone deserves a voice, and sometimes it takes time to develop that. So stick with it. It's hard work, but everyone deserves to be understood. So we want to make sure that we are helping everybody get to a place where they can be able to communicate.
That's so profound. Everyone deserves a voice. And there's so many things that you could think or say about that in different ways in our society, right? From people who have been oppressed or traditionally not able to speak their voice safely. So, such good advice. Lisa, where can people find you?
You can find me on my website, speechstrategiesnc.com. Ask your pediatricians about me, or I try to get out in the community, so you can try to find me there.
Do you have an Instagram or anything like that?
I don't have an Instagram. I do have a Facebook, so people can find me on Facebook as well.
What's your handle?
Speech Strategies NC.
Speech Strategies NC. Well, if anyone is looking for a speech language pathologist, I couldn't recommend Lisa more. And thank you so much for being here and giving us all this time and your expertise. And I hope we talk soon. And I'm wishing all of you guys out there well. And again, I'm Dr. Ellie, and my practice is middle path integrative pediatrics. I see kids 0 to 21 for holistic primary care. And I also do functional medicine consulting. So if you already have a pediatrician or you're an adult ages 2 to 102 and you need help with a deep dive into a chronic health issue, or you just want to improve your longevity and vitality, then definitely reach out and see me. Okay, bye guys. Wishing you well.